Well, Democrat leaders in the House are coming up short on the 216 votes needed to pass the Senate's version of health care reform. And it's unclear if Speaker Nancy Pelosi is going to be trying this controversial tactic that's known as deem and pass, or if that would even work.
The Republican lawmakers are united against the legislation, and there is a small group of House Democrats who are holding out as well. Pennsylvania Democratic Congressman Jason Altmire is one of them, and he joins us live from Capitol Hill this morning. Congressman, great to see you. So what are your problems with the current legislation, and what would it take to get you on board?
I've said from the beginning, this has to be about bringing down the cost of health care for people who have it now, for families, for businesses, and for seniors. And the initial versions of the bill didn't do as good a job as we could have at that. That's why I need to see the finished product and see that we're restraining the growth of health care in the long term, because we're never going to get our long-term budget deficit in order unless we address health care costs. But we also have to bring down the cost for people who have it now.
All right, so 3 times in 10 days, that's how many times you've spoken with President Obama. He's trying to get you on board, trying to get you to agree to any final legislation to pass through the House. Are you any closer to leaning in the direction of saying yes this time around?
I need to see the finished product. There's no CBO score available yet. The bill isn't available yet. We expect that perhaps as soon as today. And at that point, I'll be able to go through it and see if some of these concerns have been addressed. But I will say this, I think the current version of the bill is much better than we had in the House in November. But I don't think the Senate bill is passable by itself. So we do have to find a way to adjust for getting the Nelson Agreement out of the Senate bill, bringing down the cost of health care for people who have it now, and making sure that the coverage and insurance reforms are still intact.
On that point, Congressman, of the Senate bill being passable in the House, of course, a lot of the attention is focused on potential procedural maneuver here that may deem the Senate bill to be passed. I mean, don't want to get into the overall mechanics of it, but basically the House would pass a bill called a fix-it bill, basically, and then they would deem that the Senate bill had been passed. It's also called the slaughter option for Louise Slaughter. What do you think about the potential for using that whole process to get health care through the House?
I don't support that as a way to do the health care bill. Clearly, it's within the rules. Yes, it's been used before, but this is the biggest social policy that this Congress has been this close to passing in 45 years. The polls at best are mixed on this, perhaps even tilting towards public reluctance to do this. And I think the biggest thing is that the public has to accept the process and the policy that we've passed. And if we start going around the rules in a way that the public's not comfortable with, in a strictly partisan way, adding student loans into the bill, we're already using the reconciliation process. I just think all of this increases the opportunity for the public to say, you know what, I'm not comfortable with this process.
And what are your constituents saying to you? Do they want you to vote yes?
My constituents definitely lean with some discomfort with the bill. I've been hearing from them by the thousands this week. There's a sizable number that support it, but there's no question that the polls that you're seeing around the country are similar in my district and the response that we're getting. And what I have to be able to do is go back home and articulate why we need to do health care reform and why this bill addresses the concerns that I've had on their behalf since the beginning of the process. But I can't make that judgment until I see the finished product.
Well, once you see the finished product, if you are comfortable with the finished product, and this gets back to process again, should the House decide to use this deem and pass measure, would you be willing, if you like the bill, to hold your nose and let the process take place?
I can't control whether they use the process or not. All I can control is what my vote is going to be, and that's definitely going to make it more difficult for me to support the bill, because I think public acceptance of such a big policy change has to be part of the equation.
Okay, so but there's a difference there, Congressman, between making it more difficult for you to vote for the bill and an absolute no red line. So would you be willing to vote yes if you get the bill that you want?
The only absolute definitive red line that there is for me is I will not vote for a bill that increases the deficit by even 1 penny. Everything else, I'm going to look at the bill in total, including the process. But I will tell you, it doesn't help me to get to yes to go through this process. And I know it's making my constituents more nervous.
Well, and Republicans are targeting Democrats like you, those who are up for re-election come this November. And they're actually running former U.S. Attorney Mary Beth Buchanan to try to challenge you. At the end of the day, how much of this is going to be about your political survival as well? You know, if you vote one way and you get voted out of office because of it, what are you going to do?
I still have to look myself in the mirror and know that I did the right thing for my constituents. They put their trust in me. I can't worry about the politics. This bill is too big to think in those terms. I have to go back home to my community. I have to live there. I have to look at my friends and neighbors. And in order to do that with a straight face, I have to know in my heart I did what was best.
Congressman Jason Altmire of Pennsylvania, good to talk to you this morning. We'll continue to follow your particular role in this process and see which way it goes for you. Thanks very much for joining us.
Thanks.